If a mother came to you and was not sure what to do about feeding a child, what would you tell her the first time you saw her?
Well, we always try to encourage mothers to breastfeed, and there are several advantages to breastfeeding. Lots of advantages. The first one is it is nice and it's fun and it makes for wonderful mother-infant bonding. But also, it's been shown repeatedly that breast milk is best for the baby. If it's at all possible for the mother to breastfeed, it's probably the best advantage to the baby. Breastfeeding is natural, but it's not always easy. So it's good to have some advice and expertise of your professional pediatrician, your nurse practitioner, your breastfeeding advisor to help you get started. Your best thing to do is to show your breasts right before you deliver a baby, the month before, to your obstetricians to see if you're going to have any difficulty. If you are, you should be definitely sent to a lactation specialist so that they can help you prepare your nipples for the baby. Now, as far as why people like to breastfeed, some babies are very colicky on formulas. They do better on breast milk. They tend to have less allergies on breast milk, although that's not 100%. They tend to be stronger and healthier because they get immunity from the breast milk. They have fewer ear infections. They have fewer stomach infections, gastroenteritis. They just generally have a better first year of life if they're breastfed. So I try to get all my mothers to breastfeed, and as a matter of fact, in my practice, there's about a 97% breastfeeding rate.
Do breastfed babies have a tendency to have a higher IQ?
I don't know if any studies. They have had a couple of studies that show that it might have an effect on the IQ, but I don't emphasize that. You can't always tell. There are many factors that affect the IQ.
If you're going to breastfeed, how often would you attempt to breastfeed the baby in the beginning?
When the baby's first born, it should be breastfed in the delivery room. If you could possibly get the baby to latch on your nipples immediately at birth, the baby nurses better from then on. That first nipple that he experiences is if it's his breast, if your breast rather than a bottle, he will be a better breastfeeder. Most babies are hungry right after they're born, and it's easy to put them onto the breast. As they get a little older in hours, to 1 hour, 2 hours, 10 hours of age, they tend to get sleepy and they don't nurse very well the first day. So we like to try to catch that first feeding as early as possible. After that, we try to nurse them every 2.5 to 3 hours, and it depends on how well the baby is sucking whether or not that feeding is going to go a long time or a short time. Nowadays, rather than the old advice, we tell mothers to try to do a whole feeding on one breast, to let them nurse on one side until they're finished, burp them. If they want more, try to nurse again on that side to try to empty the breast. And then the next feeding, 2.5 to 3 hours later, we'll give them the other side. This is new advice. It just came around in the last 5 or 6 years. It's shown that the last milk that comes out of the breast, when it's almost empty, has the most cream in it. It's the richest milk, and the baby actually gains better from one side than he does from taking part of both sides. And we found that most mothers' breasts will accommodate to filling up alternately like that. However, in the very beginning, sometimes you have to nurse on both sides just to relieve the pressure, or sometimes you have to pump out one side if the baby's finished from the other side. So that brings me to a whole different issue, which is how to avoid the pain and difficulties of sore nipples and engorgement right after the baby's born. Babies nurse for the first couple days, and if the nipples are flexible and they can latch on, the mothers feel fine. But then two things happen. One is the nipple gets sore from the baby's sucking on it, and the other is the breast gets too full. The milk will the first milk that comes out is called colostrum, which is clear, and the breasts are not very full of it. And then suddenly, in a young mother, age 18, 19, 20, within 48 hours, it will change from colostrum to milk. As the woman gets older, especially as she gets into her late 30s and early to mid 40s, that transition can take a lot longer. So the younger the mother, the quicker they switch over to milk. But when it happens suddenly, the breasts become extremely full, and it's something called engorgement happens. When that happens, it's critical that the mother keep nursing and nursing and nursing and pumping her breasts and emptying her breast at the end of a feeding with a pump, and you can store the milk in the freezer if you want to, but not to let the breast stay too full. In the later weeks of nursing, the more you nurse, the more milk you get. But in the beginning, the engorgement is going to happen no matter how much you nurse, and if you don't empty those breasts, they just get more and more and more engorged. You produce enough milk for triplets the first few days. You just have more milk than you need. So pumping it out isn't going to, it's on overdrive, it's not going to make any difference. So you empty it, it'll soften the breast, the pain will go away, you'll feel much better. We also advise mothers to wrap their breasts in green cabbage leaves, because that also helps to relieve the pressure on the breast. That only lasts for a day or two, and when the engorgement's over, then she can settle down and just nurse the baby for what he's hungry for, finish that breast, and then go to the next breast on the next feeding. As far as how to avoid the soreness of the nipples, the most critical thing is the baby has to really be attached properly, with the whole areola in the baby's mouth, not just the top of it, that the nipple goes way back into the back of the baby's roof of his mouth. And if you're not sure, if your nipples are hurting, it's possible he's not latching on well. When that happens, you really need a lactation specialist to watch the baby suck and to see what's wrong. Sometimes you need nipple shells to help bring out the nipples. Sometimes you need a nipple shield to protect the sore nipple. But that's something you need expertise with. It's very hard to do this on your own without somebody who really knows what they're helping you with. Some people ask me if the baby can have any bottles at all. In the first few days of life, it's better for the mother to nurse round the clock. However, some mothers are so exhausted, especially if they've had cesarean or if they were up all night in labor, then the baby has to be given something. The baby can be given formula in the first couple days of life. The fewer bottles, the better, because of this problem with what they call nipple confusion. When they feel a very long, chewy, rubbery nipple, they prefer that to a breast nipple. So we like to get the baby used to the breast first before we start offering them anything else. Later on, if the mother has to go out, it's best if she pumps out some milk and gives the baby her own milk by bottle. Or the baby can get supplemented by formula if it's necessary. Now, I don't want mothers to feel absolutely guilty if the baby has to be given a bottle. But in the beginning, just to get them set on the breast, it's best to give as few bottles as possible, especially the first month of life. If the baby's been nursing terrifically well for a whole month, giving them a bottle is a good idea, because you want to be able to get out sometime. And if you never give a bottle, then the mother's tied to the baby indefinitely. So at some point in time, between 3 and 4 weeks, we tell them to offer them a bottle at least a couple times a week to see if they'll learn how to take it. Each feeding is variable. Some babies will finish a feed in 5 minutes. Some of them will take up to 30 minutes. We usually say that by the time they've been nursing for about 20-25 minutes, they've probably gotten as much milk as they need. But it depends on how pokey a sucker. It depends if they're falling asleep in the middle of the feeding. You can't make a legislated rule. But once the baby is finished feeding, we like to burp him, change him, and let him digest that food, not to nurse him again 20 minutes later, an hour later, an hour later. It's best to wait about 2.5, even 3 hours between feedings so the baby can get hungry and take a decent feeding and go back to sleep. If the baby is very, very hungry and you feel your milk hasn't fully come in yet, then nurse more often until your milk comes in. Then you'll see that you'll be able to stretch the feedings a little bit. I have mothers in my practice who nurse for 2 years. I have mothers in my practice who don't nurse at all. It's all an individual, what works for the mother, what works for the baby kind of thing. One thing that you'll find when you're nursing a baby is most women do not menstruate if they're full-time nursing. They nurse without periods, and they tend to not be able to conceive while they're nursing. It's not a guaranteed birth control, but it definitely does have an effect on child spacing. Mothers who nurse who aren't using birth control tend to have their babies further apart. And a lot of women like this effect. It gives the baby a chance to be a baby for a while naturally. So this is a form of natural child spacing. Most of the time women will continue nursing and start